And we will begin in about a minute. I have a couple of people that are just signing in. Okay. And put that down. So at this time, well, for those of you that are new, welcome. My name is Teresa Reinders. I'm the director of the Racine Continuum of Care, and you are at the meeting that is for the community outreach arm of the Continuum of Care, and that is the Homelessness and Housing Alliance of Racine County, aka the Alliance. And this is we meet every other month. So this is our, I was going to say July, our May meeting, and welcome. Today we're going to start by, I'm asking for a motion to approve the consent agenda, which has that approval will mean that you're approving also the reports from the short reports that are from the committees and the presentations. And so if I could have a motion to approve.
Pam Handero, I move to approve the consent agenda items as provided.
Thank you, Pam. Is there a second?
This is Becca Fritzl. I'll second.
Thank you, Becca. Okay. Well, there's no discussion on it, I guess. I would say all those in favor, please respond by saying aye.
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 Awesome. Any opposed? Hearing none, and I do not see any in the chat. Any abstentions? Hearing none. I don't see any in the chat, so we are going to approve the agenda and move straight on. I'm going to open this up for a 10-minute discussion by Scott Metzel. Scott, you should be able, if you need to share the screen, I have it on. If anybody needs to share the screen, I have it on already. So go ahead. Thank you.
I'm Scott I'm a co-chair of the System Performance Committee.
Can't hear you, Scott.
You can't? Uh-oh.
Yeah, the volume's really low.
All right, that's bad. Let me
Still low.
fix that. I'm not sure why. Can you hear me now?
No, it's very, very low. It's like you're.
Well, maybe I have to shout here in my office. I don't know. Okay, let me. How about now?
Oh,
That'll
there
do
you
it.
go.
Sorry.
That's good.
Yeah, you know, at this point in life, you'd think I would be better at Zoom meetings, but sorry about that. Yeah, starting again, I'm Scott from System Performance Committee. I'm a co-chair with Arida Vasquez, who I believe is also here. I saw her name in the sign-in. We presented last month on system performance measures for the last fiscal year, and we looked at things like length of time homelessness, returns to homelessness, exits into permanent housing. And in the last meeting, we really looked at whether homelessness was rare, brief, and non-recurring in Racine. You can look at the presentation. I think it was attached to this, the minutes for this meeting. And as part of that presentation, at the end, we had some discussion, and Vicky asked that we go a little more in depth into racial disparity in homelessness here in Racine. We touched on it a little bit when we looked at the number of people homeless at at the last meeting, I did a little bit on racial disparity, but we didn't go in depth. And she asked that we go a little bit more in depth. And I'm not going to do that today, but we did meet again and try to talk about it. We reached out to her to see what kind of information she would like and what we can do. And we think we'll do a presentation on homelessness and racial, ethnic, and gender disparity in Racine in the winter of 2020 or fall, maybe in September or November. So we talked about it with Arida the other day and with the System Performance Committee, and we think we can present on racial, ethnic, and gender disparity among the population of people experiencing homelessness here in Racine. So that would mean that we look at the percentages of different groups within the general population, and then the percentage within the population of people who are homeless, and see if there's disparity, meaning there's a difference. If there's a difference, what you would expect if all things were equal is that the percentage of people who are African-American in the homeless population would be the same as the percentage of people who are African-American in the general population. If it's not, then there might be a disparity somewhere, and we can look into that further. Then, because we are a System Performance Committee, we'll look at gender, ethnic, and racial disparity in the system performance measures. So when we look at length of time homelessness, returns to homelessness, and things like that, is there a difference by race, gender, ethnic in terms of those things? So we'll dive a little deeper into our system performance measures by those areas. And then we'll also look at equity analysis along the same lines of housing outcomes. We see the number of people who are homeless from different groups in Racine. Are the outcomes the same? You would expect the percentage of the outcomes to be the same as the percentage in the population. We'll look and see whether that is true or not. We haven't done this yet, so we don't know. And we talked a little bit about what kind of data we're going to use. There's a lot of ways we can report and look at it. And this one, Arida and I always, can you hear me?
Yes.
Okay, this one, Arida and I often have a conflict over this. Arida really loves household level data, which we use a tool called Stella. I tend to like individual data because I'm like a pit count kind of person. There's pros and cons to each, but for this one, we decided that we're going to use the data by counting individual people rather than households. And the reason for that is that there are households that have multiple ethnicities, races in them. They could be, a lot of different households out there. So we really want to reflect the individuals who are in those households. So that's what we want to try to do in the fall. We saw that there were some limitations of some of the things that were asked of us. Vicki wanted to see if we could look at some of the things essentially related to homelessness prevention. We don't have a whole lot of data on that. And part of that is we're using the HMIS system. So we can only use HMIS system to get really good data at this point, which also means we don't get data from the providers, the agencies that work with people who are fleeing or who have a history of domestic violence and are specifically in a DV service provider. Also, it was an interesting request. We're asked to sort of break down the different categories of homelessness by race, ethnicity, and gender. And it's really very difficult. But I just thought I'd talk about that a little bit. Category 1, and these definitions come from the HEART Act of 2009, and that was the act of Congress or the legislation that actually allocated a lot of the funds that we use to try to end homelessness. And as part of that legislation, there are definitions of homelessness that we follow. Category 1 is the one that we use most in our services here related to our HUD Continuum of Care funding, Emergency Solutions Grant, and so on. And category 1 of homelessness means that you're either unsheltered, living in a place that's not ordinarily used for human habitation, or you're in a shelter or transitional housing, or you're being discharged from an institution 90 days or less after having been unsheltered or in a shelter. And that's what most of our programs are working with. Category 2 is imminent risk of homelessness, which means you're within 14 days of an eviction with no subsequent residents identified, not enough resources. And that category, it could actually include a very broad number of people, and we don't have a whole lot of data in that. It's sort of related often to either prevention programs or as a reason you're entering shelter, but then we see the person from the shelter rather than imminent risk. So we don't have a lot of data to break that one down. Category 3 of homelessness is sort of called housing instability or at risk of homelessness. And this is homeless under other federal statutes, like the Department of Education. When Kaylee Cutler from Racine Unified talks about homelessness through McKinney-Vento and the work that she does, you'll notice that the numbers look different from PIT counts. It's because we're using different definitions. And in the category 3 definition, it would mean that you're sort of staying with other people, you haven't had a lease in 60 days, you're moving around, a real instability of housing. And this actually is probably the vast majority of people who have any kind of homelessness in Racine, but we really just don't have good data on that. Then category 4 is people who are fleeing or attempting to flee domestic violence, sexual assault, or other things related to violence. And in most of those cases, they would be working in agencies that don't use HMIS. So we have a lot of limitations in terms of what information we can access to do these kind of reports. And we're mostly focused on category 1 of homelessness, meaning unsheltered or in shelter transitional housing for our reports. So that's what we're going to do in the fall. And I thought I would open it up to see if there are any specific requests or areas of interest you'd like to see if we could cover or include in a presentation like this. So I'll open it up if there's any areas that you'd like to see us cover concerning racial, ethnic, and gender disparity. Am I even here?
Yes.
Okay. Suddenly I had this great feel like I've been talking for 8 minutes and I was like not even there.
No, you're fine.
Okay, good.
That's how I feel a lot of times.
If there's nothing, Arida, do you have anything to add?
No, I think that was a great summary. The one areas that I just wanted to make sure that people knew that there was an ability to drill down into the data at a household level and at an individual client level. So if there is a household of mom and 3 children, you can look at both versions. But I think what Scott mentioned in regards to wanting to look at all household members when it comes to racial identity is perfectly fine, not an issue. So.
Yeah, and we do use households a lot when we're looking at data for like exit to permanent housing and things like that. It is a very useful way to look at how we're serving households, but we thought for this one, it might not be the best format.
Seth?
So I know, I mean, I'm very aware of the limitations on data, especially given that the hospitality center serves lots of people in kind of across the spectrum of those different categories of homelessness. What I'm wondering about is not so much around the racial and equity conversation, but really around like the data collection piece. I'm really curious if like the system performance metrics can somehow incorporate the McKinney-Vento data that the Kaylee collects, and then if there might be some work done on either figuring out what other COCs do around collecting data in these other categories of homelessness, trying to learn just ways to solve this issue of data collection. I think that would be something I'd be interested in helping with.
That's excellent. Arida, do you want to take that or?
Sure, I can definitely speak to the fact of the McKinney-Vento and serving that population for schools, basically, that category of households who are not at imminent risk of homelessness or and are kind of a broader spectrum. That is not built into what HUD has in the specifications for our system performance measures. So that isn't a component there. If that was something that is intended in the future, that could definitely be built into it. But at this point, it's not a function. And can you repeat your second question?
Well, so I guess to that point, like I understand that like HUD doesn't do it and HMIS doesn't do it, but I'm wondering as an alliance or as a COC, can we do it?
Yeah, it's a matter of whether, that there can be, and that would probably be a supportive service program in and of itself, because it wouldn't be clients who are in an emergency shelter or a safe haven or transitional housing project. So if there was, and then what would be the intent of having that data entered into the system? I mean, if there's a project that is serving that clientele, that could definitely be, there would just have to be following our governance documents. It would be a provider that would want to.
I mean, I get the like ICA does one part of the data. Like, I get that. What I'm wondering about is, can we draw in data, not into ICA and not into HMIS, but like from other sources, so that we can see, so that we can have a more comprehensive look at what homelessness is like, not just relying on that category 1
Sure.
data.
So are you
So
thinking?
I'm not making an ask of you, right? I'm making
Sure.
an ask, I guess, generally of like the CoC.
I
Speaking-
think, Seth, I think it's a really good point, and it's something that would be really helpful, because that covers a real broad group of people who are facing housing instability here in Racine. It's huge, and I'm not sure what other agencies are seeing over the last couple of weeks, but we have had an uptick in unsheltered homelessness. I know Halo's full, but there's also, it seems like a lot of instability, people getting evicted and coming up, and seems like we're getting a lot of people walking in calling about housing instability, even if they're not on the streets or in shelter yet at this point. And sometimes we offer some kind of assistance for that and would like to track it. Is it possible? Sure, it's possible. And I would also agree with Seth that we should probably do it. It would be a matter of figuring out how to do it. I would guess, what Arida is saying, you probably could even track some of that in HMIS if we wanted to do it that way, doing sort of a non-CoC type project. Wouldn't that be possible, Arida?
Yeah, it could be a direct entry into the system, or if they're
Right.
talking, or if Seth's even thinking about a data matching project. That
Yeah.
is a different way to do that, in which it would have to just go through the continuum
Yeah.
to actually do an agreement to that, and then it has to go to the advisory board at the state level. So, yep, different ways to be able to do that. We can definitely have further discussions about that.
So I think it's worth looking into. I think we'd want to define what we want to get. First of all, what do we want to track, and what do we learn to help improve our services, and who is serving those people, and then figure out how we would collect the data to do that and put it together. As Arida says, it's not really SPM, because the technical system performance measures come out of the Hearth Act. Well, to show the progress in the Hearth Act, they have a really specific purpose, but it's a clientele that we serve, and I think it's worth looking into. So we could do that if you want, try to get some ideas together.
Mhm. Yeah.
Yeah, I'd be
so
really interested in doing that. So.
Sure, great.
that would be interesting. And then we would also need to look at accessibility, who's going to have access to that data and what it's going to be used for, set some parameters, and figure out how we would fund, if needed, the additional work. Any other questions?
So, Seth, first, check out the Chicago Coalition for the Homeless. They have some really, really interesting data that they've devised methods for. And they have a really cool network of working with emergency rooms and healthcare providers to figure out homeless numbers, which I thought was really interesting. A lot of work on youth homelessness there. So dig around. If you need a connection there, I know I have a couple of friends who still work over there. And then Scott and Arida, I'm going to be reaching out to you guys for the home ARP work, probably trying to figure out some data to pull for sussing out needs and stuff like that. So we'll I'll reach out to you guys. I don't know exactly when, but soon. And just be ready.
Thanks, Brendan.
Thank you.
Any other comments, questions? Okay. Seeing none, we'll turn this over to you, Seth.
All right. Thanks, everybody. So I am here this morning to present on a project that the Hospitality Center has been working on for quite some time, along with a number of partners in the community. which is a co-located resource center serving folks who are experiencing homelessness and poverty, hunger, a need for provision of basic needs as well as mental health supports. So I have probably about 10 minutes here of information, and I do have a couple of invitations or asks at the end. The Hospitality Center started work on this project a couple years back, really asking the question about, how to best develop the services of the Hospitality Center and a place for the Hospitality Center that is better integrated into the community, so that we're more centrally located for serving people in need, as well as being placed in a position within the community that would be more conducive in a better environment for the Hospitality Center based on our clientele and for access to services. And so we began exploring this model of co-location, which really a lot of the model for this has been drawn from the Sojourner Family Peace Center, which is up in Milwaukee. They follow actually the Family Justice Center model, which is really in the area of DV, but can be translated, I believe, into the area of homelessness and poverty issues in general. And if you're not familiar with the Sojourner Family Peace Center, it's a really incredible model they built in 2015, where they have a variety of agencies who are on site with them in the setting of a domestic violence shelter and service provision area. I'm going to share the screen here just to give a little bit of a visual of that. So you can see here, these are all of the agencies that the Sojourner Family Peace Center has on site. And there's some really interesting pieces. It runs the gamut from a connection with the education system with MPS to healthcare with Children's of Wisconsin and Advocate Aurora, but also legal services, and then Core El Centro, which is actually focused out on site at the Sojourner Family Peace Center on wellness. And so they have various wellness offerings, such as massage and Reiki and other things. And so this model of co-location is, I believe, a really compelling way for Racine to pursue what we've been talking about and what I believe the purpose of the CoC and the Alliance is, which is providing collaborative services, both to increase access and impact for guests, and also to increase collaboration among agencies. And so this material here from Sojourner actually was just published here recently. And I just wanted to read a couple of these quotes about the benefits that the agencies that are involved in the Family Peace Center see. It says, the most frequently mentioned benefit of this one-stop shop model is increased clients' access to services from a single location. And this quote down here from one of their staff says, before this building, therapy or any kind of mental health support was a need. We had some go-tos, but nothing like saying we have psychotherapists upstairs. And it said that's probably one of the more valuable referrals, more frequent referrals that advocates make on site. There's a lot more of this material here, but I wanted to show it as an example of a model that we have the opportunity to replicate here in Racine in a unique way, our particular context. So at the same time that we were considering this co-located model, we also did some research on best models for both day services and shelter and housing operations. The partners that have been with us in the project, which I'll mention here in a minute, traveled to a few different sites, one up in Milwaukee, St. Ben's, one up in St. Paul, the St. Paul Opportunity Center, and then a site down in St. Louis, the St. Patrick Center, really kind of searching out for models of day services and models for collaboration between agencies that might help inspire us here in Racine. And so we identified, there are some really interesting similarities between those places, even though they also have significant differences. And so for the Hospitality Center, we know that we need to expand a few kind of core services. And so in a new center for the hospitality center, we're looking at putting in showers, a laundry facility to service our clothing closet, some guest storage space, kind of a concierge or intake space for guests and clients, a wellness room that is, you know, a salon space, but also a space where massage or acupuncture or other services would be provided, dedicated group meeting space, individual counseling space, and room for health assessments. And so those will be all new capabilities. In addition to some expanded capabilities, which would include increased meal capacities. So we're looking at increasing our eating space to include a space for 175 people, a dedicated chapel space. A really important piece for us is actually building space that would be specifically for families, for both eating together and for counseling space, so we can provide a safe location for people that have young ones with them. A fully accessible clothes closet, and additional space for future partners. And so this, so that's really a key piece of this, is that we see this as the hospitality center leading an effort, but in collaboration, and really only successful with the collaboration of many organizations here with the CoC. So I'd like to share here on the screen a little piece just about what we have currently for partnership, and then where there are possibilities to expand this vision. So we've been working with 6 organizations, including the Hospitality Center, with Halo. Had a really good conversation with Holly yesterday at Halo about looking toward Halo being able to provide on-site diversion programming, as well as the potential, which I'll get to in a minute, of housing being on site, where they would provide actually the case management for permanent supportive housing units. The Hope Center, with Scott's leadership, being able to provide some assistance with the diversion piece, as well as kind of intake and direction into coordinated entry. NAMI of Racine County, locating their services on site so that we can help provide access for people for peer support, and the education around mental illness that they bring into the community. Racine Vocational Ministry, doing their work around reentry and job training, their holistic approach there. And then the Catholic Charities Racine office, that provides mental health counseling and bilingual support for people experiencing all the issues around abuse, divorce, all the stress that comes with family conflict in life. So that's those are the current partners we have on site. We know that to really provide a comprehensive approach to the issues around homelessness, there are other partners that would be needed to make us truly effective. So we're especially looking for connections in the areas, the area of the legal arena, veterans services, perhaps, areas around family and children, and trying to boost, crisis services. I think especially the mental health crisis counseling would be an important piece for us to develop there on site. So we are fairly far into the planning process around a campaign and site selection. I just wanted to share a screen here that shows that site selection. Sorry, I'm many things to toggle between. All right. So our proposed site is what is currently a vacant building on the north side of City Hall, which was the DaVita dialysis building, and incarnations before that was the United Way, child support office, many things back in its history. actually had houses way back in the day on that site as well, before any of our memories. So this graphic here kind of shows you where this proposed hospitality center and co-located resource center would be placed in Racine. And it's the overlay here is a really interesting map of income. And so you can see that the major reason we would like to retain a connection to downtown, because we know that that's where many folks who currently use our services reside. But we also want to position ourselves so we can serve more of the community. And so this gets us, a little bit off the lake and off of Main Street. And it puts us really kind of equidistant between these major swaths of Racine where people are living in the lowest income levels. So we see.
Someone turn some my keys. I lost them in last area. They have like a purple ring on them. Yes.
So we see, kind of the darkest red or purple being the lowest income areas.
And
and being at
it
this
would say my name
point,
because one of the little, like on the key thing happened.
sorry, being at this point, this kind of intersection at City Hall where you can go down Washington Avenue, or across to Marquette Street up to Memorial Drive, where people are able to access these services in a centralized location. So that's the site selection. Here's a visual of, this is obviously a rough sketch here, but just wanted to share this with folks of what we propose this would look like. So this beautiful pink purple building is this co-located resource center. This would provide 32,000 square feet of space. 16,000 square feet of that would be devoted to hospitality center services. And then the remainder of that, mostly the second floor, would actually be office space and group meeting space for those co-located partners with us. And then you see this orange building, which is a proposal that we are developing with Heartland Housing that does various types of low-income developments in Milwaukee and Chicago. And their proposal is to establish a 55-unit complex, 15% of which would be permanent supportive housing, people coming out of chronic homelessness with case management, and then the remainder being a mix of low-income housing. The design here is set up so that we would have separation between those two buildings and the operations of those facilities. We would have a green space in the middle so that we could provide some outdoor space for residents and guests that is, within the campus rather than on the street and outside of the campus. So again, this is obviously a rough rendering. There's lots of details to be, to be worked through in terms of this design and the development of that. The permanent supportive housing piece and the low income piece, I think, is a really critical part of this vision because it does allow us to make gains on the need for both of those types of housing within Racine, emphasizing single bedroom apartments and then those about 8 or 9 units of permanent supportive housing. So our next steps in this process are we have ongoing conversations with the city regarding the site and some ways to make sure that it's the best solution for everybody involved. So we have a meeting set up next week with the city regarding that. We're heavy into the fundraising stage in the background. We're kind of in the quiet phase, looking toward the later summer or fall for more of the public phase of that campaign. With a potential end to that campaign in early 2023. So as far as next steps for us here for the CoC, I have 2 asks. I think one is, we need, because of the nature of this project being a really large project, it has a $10 million goal for it, and the fact that it is a collaborative project between many agencies, we would really like to have a statement from the CoC of support for the project. And so I think what I'd ask for today is maybe if we can decide that we would adopt a statement of support that might be provided by Teresa for the project. And then the second ask is for partners who are here on this meeting today to really consider if your agency might benefit from co-locating services on this site, and then to begin a discussion about what that might look like. I think there's, you can talk to the other partners that we have on board to see, how they see this would benefit their operations. I think long-term, we see that this could develop into some sharing of resources, whether that's, administrative or physical resources, but really hoping that we would be this collaborative site that we can really synergize efforts to address homelessness and issues regarding poverty and mental health in Racine. So that's what I have. I know it was a lot and it was fast, but I'd love some feedback.
This is the part where you feel like you're alone.
That's right. I mean, I can see all of the names. So
Yeah.
This is Tamara Patton. I have a question. So are you thinking too that this is going to be kind of like a coordinated entry point, like forming it to, be that starting point more for people and opening it up, and then, going from there with, going from there to services and things like that, so that we can have something that's really identifiable in the community?
Yes, yeah. So I do think that is one of the ideas that we would love. We're not there yet, but we would love, for example, for like the Here to Help, efforts that the county is doing to be able to be located in a site like this, so that we could really have a point of entry for not just, I mean, definitely for housing services, but also for other services that are related to homelessness. And being able to have a warm handoff, which I think is really the key. If you look at the Sojourner Family Peace Center model, that you have an actual physical handoff to the next step in someone's process, rather than a direction, a phone call, or a message left, or something like that.
Seth, this is Mary Beth from United Way. Great presentation. And with these resources, the additional agencies, are you, I'm thinking about like access wise, so some of these agencies might have like night hours, meaning like evening group sessions. So
Yeah.
what would be the accessibility of this building?
Yeah, so that is one of the reasons why it's important for Hospitality Center to move and establish a new site, because we are, one of the things down the line that we hope we to be able to develop is using that space on a more extensive basis. Where we are right now, where we cannot, do things in the evening. We also have no parking, so that's a challenge. So this would be a space that could really be utilized in many different ways, whether that's extending meal services into the evenings, group sessions, community meetings. That would be the intent behind the space.
Tamara Patton, another question. What types of legal connections are you looking for, like attorneys to be on site for pro bono type legal services? Is like, I'm assuming you've approached like legal action already, but I know they're, booked and like, they're just overutilized because that's about the only, low income legal service. So what are you thinking with that?
Right. Yeah. So we did approach legal action. I think there are issues around how their grant funding works in terms of how they can set up offices and stuff. So that it didn't seem like that would be a possibility. Although I am still interested in continuing those conversations, because we see how that actually does work at the Sojourner Family Peace Center. So I don't think that's the end of the road there. But there are also other agencies around, like the ELCA Outreach Center in Kenosha, which does do legal services. They also work with RVM, and so that there's a potential there. But honestly, like the Hospitality Center's goal is to not create additional services beyond basic needs. That, like, our lane is basic needs and providing a community space. And the invitation really is for agencies and people with expertise in the community to join in that partnership and offer their expertise.
Yeah, and to like even add to that, I was just wondering like what you see for needs and things like that in that, and that could be a different discussion, but just having, you know, a better idea too, because we are a for-profit law firm in the area, but we also have a nonprofit where we could, you know, potentially, you know, raise funds or do grants for you know, outside legal services, which is something that I could possibly look into and chat with you more about what other funding is out there for that to partner with you. So
yeah, that's great. I mean, you know, I think we've talked about at the CoC level around, you know, especially eviction issues and even mediation really being kind of the key starting point for that. And so I think that would be something that could be, you know, very beneficial to be located here.
Okay, well, thank you, Seth. That was a good presentation, and you need to keep us all informed as you go along, and it sounds exciting.
So I would like to just push a little bit on this issue of having you know, kind of an approval of support from the CoC. I think
From the Alliance can give the report, can give the approval at this point in time. The CoC would be the Leadership Council, and I would like to see some more things in writing from you for that to give to them. So does somebody want to make a motion that we provide a official statement from the Alliance to support the intention of the project to kind of move towards adapting the services to a better response? I don't know how you want to word it. Any suggestions, Seth, on how you want to word this?
I think at this point, what is really helpful is you know, making sure that there's a statement that says, you know, that the agencies in Racine, there, you know, there's no commitment to saying like you're going to be on site or anything like that, but it's saying like there's a sense that in our community this is a need, and this is something that the organizations here in Racine, you know, in principle are saying yes, like this is a project that that we are, you know, would be vocally supportive of when asked about, you know, do you know about this thing? Is it good?
So we need a motion for, I would just like a motion that says that this is what the Alliance would like for me to do as the president, as the chair.
This is Melania from Fight to End Exploitation, and I make a motion to publicly support this future project that the Hospitality Center is doing.
Thank you. Do we have a second on that?
This is Mary Beth. I can second on that.
Very good. Any other discussion?
Alison looks too perfect.
Right.
Okay.
I think you're unmuted.
You're unmuted, Pam. Okay, so hearing no more discussion, I will call for a vote. All those in favor, please respond by saying aye.
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 Okay, very good. And all those opposed, please respond by saying aye. Hearing none and seeing none in the chat. Any abstentions?
I abstain. I'm not allowed to vote on this one.
Okay, very good. We have one abstention. Any other abstentions? Okay, hearing none and seeing none, the motion carries. So thank you. There you go, Seth.
Thanks, everybody. Thanks for your support and for your listening.
Very good. And I will suppose that you'll be bringing us up to date as we move along, maybe in July, a few more updates so we can keep track of everything that's going on. Thank you. At this time, we're going to move to Alison Segura. Did I say your name right? You're muted. You're muted.
There we
go. Sergio.
Sergio, okay. Sorry about that.
That's okay, close enough.
And Allison is the director of the Healthcare Network, and she is here to present to us her agency's services.
Excellent. Thank you, Teresa. Let me just share my screen here. Let's see if this actually works. Let me try that again.
There you go. You're up.
Wait, can you see me? You can see it?
Yes.
Okay, wonderful. Well, thank you, everybody. As Teresa said, my name is Alison Sergio. I'm the Executive Director of Healthcare Network. I've been here for going on 8 years now. It was a whirlwind, it went fast. And I'd like to talk to you a little bit about what Healthcare Network is, what we do, what our services are all about, and answer any questions if you should have any. So moving forward. There we go. Okay. So Healthcare Network opened its doors in 1987. And at the time in Racine, we had an economic downturn. And there were a lot of people that were losing their jobs. And while losing their jobs, then they would lose their benefits. So they were losing their health insurance and any kind of coverage that they had. And the community had come together. This is taking the story and boiling it down a lot, but the community had come together and decided that what they wanted to do was put together a temporary project, a free clinic to serve those that didn't have insurance and didn't have access to insurance or any kind of healthcare at the time. And start a free clinic where we would have community volunteers that would provide services to people in need. And so at the time we started in the basement of First Presbyterian Church on 8th and College, and we set up with just a doctor's bed, a desk, a phone, and a little screen that was kind of made the room, the medical room. And we had people that would just come through, our volunteers that would just come through and volunteer to provide ongoing routine care for those in need. It was supposed to be a temporary project. Everything was going to change. And at the time, few years after that, the Clintons came into power, and their whole platform was national healthcare. And so we were going to have national healthcare. And again, Healthcare Network was just going to be a temporary project. And here we are 35 years later, and we're still going strong. And in fact, arguably more important to the community, having been, as we speak right now, in the middle of a pandemic. So currently, Healthcare Network offers medical, dental, and behavioral health services. We have 350, give or take, volunteers that volunteer to provide services. We have about 13 staff members that coordinate the care of our about 9,000 patients across the county. We have 2 physical locations. We're located right downtown Racine. That's our main location on 5th in Wisconsin. And then we have a satellite clinic that is located out in Waterford. We're located on Highway 36 in the Aurora building that's out in Waterford. Our volunteers have the opportunity to either provide services on one of the 2 sites or at both of the 2 sites, or they can choose to volunteer in their own offices, effectively giving us medical and dental offices across the county. We are a medical home for our patients, and we'll talk about that in a little bit. And we provide ongoing, regular, and specialty care for them. And one of the things that we are very proud of is that we are the recipient of the Gold Distinction Seal for Standards of Excellence from the Wisconsin Association for Free and Charitable Clinics and from the National Association of Free Clinics. And that just means that we go through the process on a very regular basis of meeting the highest standards available for free clinics across the county. In the state of Wisconsin, there are about 100, give or take, there's about 100 free clinics, and all of us operate differently. Healthcare Network is one of the largest in terms of scope, meaning that we have more services than most other free clinics, and in terms of patient size. So we currently have over 9,000 registered patients using our services at any given time. So in order to be a patient at Healthcare Network, you have to be a Racine County resident. You can live anywhere in Racine County, but you have to be a Racine County resident. You have to earn under 250% of the federal poverty line, and you have to not have insurance and not eligible for insurance. So oftentimes we have people that come to Healthcare Network looking for care, and they oftentimes don't know that they have an insurance card in their pocket. Excuse me. When the Affordable Care Act was enacted and put into place effectively in 2014, we gave many people insurance. The Act gave many people access to insurance, but we didn't teach people how to use insurance. Insurance is complicated. It's difficult to understand with co-pays and all different rules and in-network and out-of-network and many different things that are very complicated. So we gave people insurance, but we didn't teach them how to use it. Still to this day, you would be surprised the number of people that come into Healthcare Network and they actually have an insurance card in their pocket. So if one of the first things that we do when we're screening for eligibility is look to see, are they eligible for insurance? If there's no reason why they shouldn't have insurance, then we do a little bit of digging to find out if in fact they do have insurance and just don't know about it and don't know how to use it, or in fact they should be applying for insurance through Medicaid or through another program that they might have access to. So we want to exhaust all of those possibilities before we take them into our program. But one of the things that we make sure to do is help them access the care that they need and help them understand what that insurance coverage does and how to get established with a provider. So we make sure to set all of those things up. If in fact they don't qualify for health insurance and are not eligible, then we will take them into our program. We do verify our eligibility at least every 6 months, or if there's a change in the family, a change in the situation with the family. So in terms of the services that we offer, like I said, we have medical care and dental care. In terms of medical care, we have access to 32 different specialties of medicine. So we're not just basic routine care. We have access to any kind of care that is needed, for the most part, any care that is needed by any patient. With dental care, we have access to 5 different specialties of dentistry. We do have on-site behavioral health services. We have a Spanish-speaking therapist that is actually employed by Healthcare Network. We do provide what's called pharmaceutical assistance. And what pharmaceutical assistance is helping our patients access the medications that they need. So it's one thing to have them come in and be seen by a provider. It's another thing for them to access the medications that they need and then be compliant with those medications. In order to help them with that, we partner with about 16 different pharmacies across the county. And then we also have an on-site dispensing room where we purchase some medications ourselves and can hand them out to patients. So when patients leave with a prescription, we make sure to get all of that set up and get them access to those medications that they will either receive for free or sometimes a small copay depending on the financial situation of the patient. We do have a social worker on staff that will assess each of our patients and is there to help patients with whatever they need from in a social service perspective. We also have a medical case management program, and this is new to us. During the pandemic, we started a partnership with Unite WI, where we have access to case managing those patients that are most fragile. Healthcare Network patients tend to be disproportionate. We tend to have a disproportionately high number of chronic disease patients. For the most part, those are diabetics and hypertensives. And then we have a lot of those that are not in control of their chronic disease. And so we take the highest needed, the patients with the highest need and put them into our medical case management program to ensure that they're going to their medical appointments, that they're taking their medication on time and correctly and compliant with those rules, that they understand their chronic disease. And we have found that that's a huge barrier to managing the chronic disease. So we break it down so that they can understand what is actually happening and what they need to do to better manage their chronic disease. We do provide diabetic education. So those patients that are diabetic and in need of nutrition counseling and just having the support of a nurse one-on-one, they meet with them on some sort of prescribed basis. Sometimes it's just monthly, sometimes it's weekly, and it depends on the patient's needs. And that's again with a nurse, a volunteer nurse. We just started a self-monitoring blood pressure program in collaboration with the Wisconsin Association for Free and Charitable Clinics, along with the American Heart Association, where we have blood pressure cuffs that we are able to give out to patients and teach them how to use them, and then have them monitor their blood pressure on an ongoing basis. Usually it's about a month at a time, and then we help them look at, well, how often did you take your blood pressure? Did you take it in the morning? Did you change the time that you took your blood pressure? How about your medications? Are you seeing any difference in terms of, now that you're compliant with your medication, is your blood pressure changing? So we do a lot to help them understand what their blood pressure is and what that all means. We do have Prevent Blindness, where we have access to doing vision screenings, and then for those that are in need of glasses, we can get those glasses for them. COVID-19 education and vaccines. So I always say that there's no better time to talk about the importance of a free clinic than during a worldwide pandemic. Prior to the pandemic, Healthcare Network was an organization where if you didn't need us, you might never know that we're here, and that's okay. But during a time when everybody is sick and there was a lack of access to resources and a lack of access to healthcare, and lots of people that were in fear for their lives in terms of what this pandemic meant, we became very highlighted in terms of the need, filling a need in the community. We work very closely with both medical systems in the county, that being Ascension Healthcare and Aurora Healthcare, and we work to plug the holes. And so we want to make sure that all of the patients that come to us or come to the hospital are getting the care that they need and not falling through the cracks. So we work to make sure that we plug those holes. In terms of COVID-19 education and vaccines, we became one of the sites that partnered with the city of Racine, as well as Ascension and Aurora, to be able to provide that education. This is our one service that we offer where you don't need to be a patient of Healthcare Network. If you are in need of information about COVID-19 or a vaccine, we will make sure to get that for you, regardless of whether you're a patient of Healthcare Network. None of the eligibility requirement is necessary. We will just make sure that you get those services no matter who you are. We have access to Uber Health, and so for those people, and for the most part, it's tied to COVID-19. But for those people that are in need of a ride to their medical appointments, we can get that set up for you. And then in addition, during the pandemic, the Wisconsin Association for Free and Charitable Clinics was able to access a license to telehealth services, and we were able to do that. So currently we have access to telehealth services if people have a phone or any kind of device. They're able to see a doctor without even having to come to Healthcare Network. Now that works the opposite way too. They can come to Healthcare Network and our volunteer might be off-site. And so they can talk to a doctor while they might be on site at Healthcare Network, and we can telehealth the volunteer in to do that. So those are primarily the services that we offer. Over the years, Healthcare Network has offered over 237,000 appointments since 1987. And that is valued at more than $55 million worth of services. I will say this, the way that we value our services, we greatly undervalue our services. So this $55 million, I can guarantee, is very undervalued. We have a very rudimentary way of doing that at present. However, we are moving to be able to put into place a real actual value to services using current and up-to-date statistics and fee schedules. And that is coming with a new electronic health record that we are implementing. We're currently in the process of doing that, and we go live on Monday with that process. So our numbers will be a lot more accurate in terms of the value of our service to the community coming up shortly. We have assisted our patients in getting more than 97,000 prescriptions valued at more than $7 million. Like I said before, we have 32 different specialties of medicine and 5 specialties of dentistry available to the patients that we serve. And currently we have served over 11,000 unduplicated patients. About 9,000 of those are active patients and have been served by Healthcare Network on some level over the years. So we have done a lot to really plug those holes. Currently, the latest statistics show that about 6% of 6% of Racine County is still uninsured. And so those are that's the population that we target. If anybody has any questions or has any patients that might be interested in becoming, or has any, clients that might be interested in becoming patients, please do not hesitate to give us a call. Our phone number is up on the screen. We have an email address, info@healthcarenetwork.org, and our website has some information on that. And then we do have a lot of information and a lot of community news on our Facebook page. So I encourage you to go and like our Facebook page. I want to open it up to questions. I want to make sure that I'm answering any of the questions that might be helpful.
Hello, this is Mary Beth from United Way. Hello, great services, and thank you for presenting today. Can you talk a little bit more about Western Racine County and what is available out there for folks?
Yeah. So as all of you know, I am sure, there is a freeway that divides the county, and the east side could not be more different than the west side. And that is, I have found the same across the board for everybody doing any kind of business across the county. It's very strange. However, when Healthcare Network patients are Healthcare Network patients regardless of where they live. So they all have access to the same services. So somebody that might live in Waterford or Burlington or Rochester has access to the same services as somebody on the eastern side of the county. What is a little bit different is that our western location is, like I said, in Waterford. They're only there 1 day a week for clinic, and then so they only have clinic 1 day a week, and then we have it staffed 2 other half days a week. So it's a very part-time clinic. And they don't have on-site dental services like we do on the eastern side of the county. With that said, anybody who is interested in getting services, they can come to the eastern side of the county too. Or, like I said at the very beginning, a lot of our volunteers choose to volunteer in their own offices. And so if somebody is calling in for an appointment, we do our best to talk to them about what their barriers are for travel. Do they have access to coming to the eastern side of the county if they need to? Or can we find a provider that they can see that is closer out to them if they can't get to the Waterford location? So what we do oftentimes is when we talk to our patients, we really assess what their barriers are, what resources they have, and make sure that they can access the services that they need in the best way possible. We do see huge differences between the patients that are on the east side of the county versus the western side of the county. Interestingly, it has been, for a lot of free clinics, there have been a lot of issues with patients being drug seeking. So asking for scripts for medication, pain management medication. That has never really truly been an issue at Healthcare Network, and I can't explain to you why. It just is not an issue that we see. As a side note, we don't provide any narcotic information, narcotic prescriptions. We never do that. We don't provide narcotics, but that has just never been an issue at Healthcare Network. However, We do see, for the most part, that a lot of our patients on the western side of the county tend to be more of the people that are getting into our services and then looking for pain medication versus the people on the eastern side of the county. I can't explain to you why. I have no idea why, but that is just the way that it is. Now, our patients tend to be a function of public policy. And currently, because of the way public policy is, our population skews mostly an immigrant population. That does not mean that is exclusively our patient population, but that is currently our current population, and that is completely a function of public policy. And so our patient population always mirrors whatever the public policy is of the time. More questions? I will say also, Mary Beth, to go back to your question, in terms of the number of volunteers that we have a lot of volunteers that come to our program. Most of the providers at Ascension are volunteers for Healthcare Network. A lot of the providers from Aurora, and we're working on getting even more providers through Aurora, are volunteers. And all of the dentists that are at Racine Dental Group, they're all providers for Healthcare Network too. We tend to get a lot of people that want to volunteer for us, either in a professional capacity or a clerical capacity, based on word of mouth. So doctors find their other doctor friends, nurses find their other nurse friends, and dentists, et cetera, and get them to volunteer. That is not always the case on the western side of the county either. So in terms of donors, volunteers, and patients, everything is almost the complete opposite from the eastern side of the county to the western side of the county. So it's an interesting challenge.
It's that big expressway.
Yeah, yes, exactly.
Thank you.
Thank you. Any other questions about the services that we provide? None? If you have anybody who is interested in learning more about our services, any patients, please have them give us a call or stop in and visit with us, and we can let them know if they qualify. And if they don't qualify, we can help get them linked up with whatever services it is that they need in order to access healthcare. So that's one of the things that we make sure to do is, and that's one of the things with our partnership with both of the health systems, is that if they don't qualify for us, then we can usually help them qualify for either a community care program within the hospital system or something else that they might have access to.
I'll ask one more question. I know you recently, I shouldn't say recently, years go by so fast. It's been about 2 years or 3 years since you're in this location now. Mm-hmm. And how is that? Have you outgrown that, do you feel already, that new location, or how is that working out?
That's a very interesting question. So for years and years, we had been located on State Street. And in 2019, well, prior to 2019, we did a big capital campaign. And in 2019, we secured space right in the old Chase Bank building on the corner of 5th and Wisconsin, and we moved here. The space that we have is about the same size as the space we had on State Street. And I do have to say, and I don't like necessarily saying this out loud, but for purposes of what it is that we do, COVID was really good for Healthcare Network in terms of accessing new programs, accessing new funds to go with those new programs, and highlighting, like I said before, highlighting the need for healthcare and community health and what that really means. As a result of that, we have expanded our programs so much that We are a little bit tight in our current space. we're getting, everybody's working a little bit on top of each other. We do have some plans for what's going to happen. We were able to secure some extra office space in the same building, but straight upstairs. And so we have a short-term lease up there just to see what things look like. Now, we do know that some of the funding and some of the programs that we have, especially obviously the COVID-19 education and vaccine, we anticipate that the funding that goes with that and those services are going to back down a little bit as COVID just becomes a piece of what we live with and not necessarily such a highlighted piece as we move forward. And so that's why we're anticipating that some of our staffing, they're temporary, going out and providing education at community sites, or we've been at the hospitality center many times, and it's been wonderful to be there. But that staffing might back down a little bit. And so that's why we're just doing a short-term upstairs lease. Things are moving at the speed of light. As you know, there's a lot of people that are doing a lot of work from home, and our work, our on the ground with patient work can't necessarily be done at home. However, there is a lot of stuff that we are able to do on screens with patients, and they can sometimes access us via, a Zoom call or through our telehealth, which is HIPAA compliant, through our telehealth portals, and talk to somebody on their lunch break, or, without having to leave their office or leave their job. They're able then to see us. And so things are shifting so fast, and we're sort of taking it day by day to see what things look like that we're not sure what it's going to look like in 2 years. We can guarantee that we're going to be here. There is no legislation, there is no proposed legislation, there are no changes coming up that would make access to healthcare universal across the board. And for that reason, and until that happens, a free clinic is always going to be necessary in any community. So we know we're going to be here, but we're just trying to make sure that we stay up to date with the times, and as accessible as we possibly can. And that may look different 2 years from now than it did 2 years ago. So it's kind of exciting. I'm somebody, I thrive on change. I love change, which does not always make my staff super happy, but I love it. And so we are ready to move forward no matter what we need to do.
Again, great services. Thank you for your leadership there at Healthcare Network. So
thank you so much. And thank you for your support. United Way of Racine County has been very supportive of Healthcare Network, and we greatly appreciate that. Any other questions? Comments, thoughts? Nothing? I don't think there's anything in chat. Teresa, do you want to take back over, or?
Yes, let's see, there we go. Okay, well, thank you so much. This was really informative. I really appreciate you stepping in and providing all the information. It's awesome to see what we have going on for people, and I can't thank you all enough for the services that you provide there.
Thank you.
So at this time, I do want to, we're going to open this up to community sharing, but I do want to call attention to the fact that we do have the homelessness forum, and that was on your invite. Whoops. There we go. That was on your invite through the Constant Contact, which is the other thing that I want to talk about. It is Monday, and the discussion is going to be on the topic of funerals and funeral support and burials. And so we will have someone from the veterans, from the VA, talking about the services that are available there, and also someone from the Wisconsin cemeteries. So you're all invited to that. The link is on your invite at the very bottom. So you can check that out. And also, we sent this out. This was our inaugural event of our Constant Contact, which allows us to send out invitations and updates. So I'm hoping that everybody got that. I'm hoping that you were able to monitor if it went into your spam and take it out of there and tried to send it from my address so that it wouldn't come through as the Gmail. We had some problems before with Gmail going through. That's why we chose the constant contact way of sending things through. Let's see, what other things are in there? The other thing I wanted to talk about is, Eugene, are you still on here? Yes, you are. Can you, Eugene Dunk, you had something about the baby shower, and if you want to speak to that a little bit, and then we'll open it up to everyone else.
Sure. So Molina Healthcare, along with Familia Dental, is hosting a baby shower free of charge to anybody who could benefit. It's on June 11th, which is a Saturday. It's in the midday, 11 to 1, and it's down at Gateway at the Conference Center. We're looking for any agencies that like to have tables. They're available for no charge. We would ask if people are able to provide some kind of door prize that we can give out with the rest of them that we have. We're also looking for speakers. If you think that audience might benefit from more information about your agency or services. We have about, I think 18 or 20 tables that are now reserved. We're hoping to get 100 women at this, and some of them bring their families to this event. We had 85 in Racine last year at the Workforce Development Center. It was a drive-through one last year. We hope to have up to 100 people this year on June 11th. But if you'd like more information or like to help us, you can contact me, Eugene Dunk, or you can contact Mario over at Familia, or you can ask me any question you want now. So, thank you.
Any questions for Eugene? The contact numbers are in the mailing that I sent out.
Yes.
So. Okay. Any other announcements or updates? Anybody? Very quiet. There's a lot of information today. Okay, well, I'm going to say thank you to Scott for presenting his request for information. Thank you to Seth for his information and requests, and Allison for your presentation. And our next meeting will be in July. And I'm going to ask for a motion to adjourn.
Teresa, can I have one more thing, please?
Sure.
I just forgot. So we talked about perhaps your agency participating, but we're also interested in you sending down your clients if they can benefit from this event. And to do that, they just contact Familia and make a reservation. But there is absolutely no cost involved, and there's door prizes and diaper bags and other things that we're giving out with diapers. No formula though, if anybody could find a couple cases of formula, but we're going to have a lot of things going on there. So please send your folks down too if they can benefit. Thank you.
Very good. Okay, how about a motion to adjourn?
So move, Pam.
Thank you, Pam.
I'll second, Jory.
Thank you, Jory. So all those in favor, log off.